This is Dr. Digvijay Singh, Director Noble Eye Care, Gurugram, and today I'm going to talk to you about squint or strabismus. Squint or strabismus, or in Hindi sometimes known as bhengapan or tir, is a misalignment of the two eyes, where both the eyes are not looking at the same spot, but one of the eyes is looking elsewhere. This leads to certain problems, other than just the looks. Squint needs to be treated not just from a cosmetic standpoint, where of course we are correcting the two eyes so that it looks normal, but also from a functional standpoint. See, for us to see binocular vision or to see things in 3D or depth, both eyes have to focus at the same point at the same time. When one of the eyes is looking elsewhere, that 3D depth perception does not come, and it becomes difficult to do certain activities like sports, maybe driving a car, or where you want to judge objects in their depth. Squint needs to be treated early in life for best functional outcome. Usually, squint may manifest within the first year of life in certain forms of squint, particularly where the eyes are deviating inwards, and there are certain squints where the eyes deviate outwards, which may get manifested later in life. If the squint is manifesting from a very early age in life, then you want to treat it early, preferably within the first 1 or 2 years of life, for the best functional outcome. Only then the brain learns how to use both the eyes together. Otherwise, even if you treat at a later age, the binocularity does not come. Squint will be treated by taking care of the cause of the squint. If the cause of the squint has been a power in the eyes or a power difference between the two eyes, then we have to give glasses. If it is a dominance difference where one eye is more dominant than the other, then sometimes we do a patching therapy. Because of a lazy eye, then you have to treat the lazy eye through patching therapy or certain computer-based therapies that are there along with the use of glasses. And if none of that works, then certain exercises are there which can help you take care of squint both physically and online, and ultimately a surgery may be needed to correct the same. Certain forms of squint can be treated successfully without surgery. These squints which are related to power of glasses, squints where exercises work very well, and squints which are related to, let's say, lazy eye, can be treated by taking care of that problem. Also, these days, some newer softwares have come that do help us improve our fusion or improve the ability of both eyes to work together. So in cases where the squint is visible sometimes and sometimes not, there are ways that we can try to treat them without surgery. But ultimately, surgical treatment is the ultimate treatment for squint because it is taking care of the misalignment between the two eyes. See, if you look at the eyeball, there are these muscles around the eyes which move the eyes in different directions. Sometimes by loosening these muscles or tightening these muscles and making a balance between the two eyes, we are able to treat squint successfully for the long term. Squint surgery is a surgery that we do when we operate on the muscles of the eyes, these muscles that are there around the eyeballs. In squint, one muscle may be tighter than the other, causing the eye again and again to go in that direction. Or, on the contrary, some muscle may be paralyzed and the other muscle is working harder. So in these cases, we weaken the muscle which is stronger or strengthen the muscle which is weaker by doing a surgery called a squint surgery. Enter the eyeball from behind, go to these muscles and move them ahead, behind, or tighten them or shift their position to achieve a balance. It's kind of like balancing a weighing scale. Squint surgeries for children are done under general anesthesia, and for adults they can be done with a localized injection near the eye. They may be needed in both eyes or they may be done in one eye. There is almost 100% outcome of squint surgeries if they are done well and planned and done by an expert. Squint surgery is the gold standard of treating squint. Thank you for your attention, and if there are any other queries, feel free to reach out to me via my website www.drdigvijaySingh.com.